For instance, if we look at unhealthy eating, we have to ask questions such as why are people eating unhealthy? Why are making the choice of buying fast food instead of buying fresh fruits and vegetables? Is it because it's expensive? And yes, it is expensive. That's why we opt to fast food. So when we look at why are they buying that, then it's because they have low income. And then when we look at the other factor, why do they have low income? Maybe it's because they don't have the level of education that helps them get employed and get a better payment, have the luxury of choosing their neighborhood, for instance, safe environment to walk and exercise that will, have like a larger impact on their health.
Well, it really is. All of this is just really intertwined.
It is, and like we were talking a couple minutes ago, that the medical things. So the medical things obviously are very important, but when you look overall based on CDC data, it's estimated that the medical stuff contributes only about 20% to an individual's overall health. And that these more foundational items, that these like education, income, where you live, do you have health insurance? These things contribute more closer to 60-70%, because as we've talked about, it's sort of a whole chain of events. If you don't have a good education, then it's going to be harder for you to find a better paying job or a job that offers health insurance. And there's data out there that shows that having health insurance, people with health insurance live longer than people without health insurance. So this is the concept of population health. That's the term that we give it, because when you're looking at the health of the whole population, it is not just focused on disease. It is focused on these foundational items. Now, one of the things is these foundational items, the ones we've talked about, they are responsible for a significant degree of health, but they're also harder to change. Okay? In the medical stuff, you can change somebody's cholesterol. You can have them modify their diet. You can give them a cholesterol drug. These other things, like education, income, health insurance, these are harder to change, but the payoff is greater. And one of the terms that we use, and it's starting to kind of get involved in sort of the lexicon is we talk about health in all policies. So, for example, in the city of Fredericksburg, I can give you a really good example. The city of Fredericksburg has a great system of walking paths and walking trails. And see, that's a public health measure.